Hello everyone and welcome to our Facebook and Twitter Live. My name is Ashley Baldwin from the Communications Department here at the Pan American Health Organization, and I am here with Dr. Marcos Espinal, who's our Director of Communicable Diseases and Environmental Determinants of Health. And we're here to talk a little bit about coronavirus and to get some updates from Dr. Espinal. Dr. Espinal, last week WHO declared that the new coronavirus was an emergency of international concern. What does that mean?
Well, thank you, Ashley. The declaration actually it's reflecting on the fact that it is an event that has international ramifications, and it's an important event which can be a risk for several other countries. Basically, as you know, we have 24 countries already affected with cases. Most of the cases, 99% of the cases, are in China. So the declaration calls for a global coordination, a global communication, all coordinated by WHO and its 6 regional offices, in this case, PAO for the Americas. So it is to make sure the countries get prepared on the possibility that they get a case of coronavirus.
Should we be more worried since WHO made this declaration?
The public needs to take precautions. There are recommendations for the public to make sure, because it's a virus, and virus can be spread by droplets and, by saying hello to someone who didn't wash his or her hands or things like that. But at the same time, it's a virus that is not of the same level of SARS, for instance, in the past, or MERS, or influenza. I mean, influenza kills more people now. So we should be worried because government needs to prepare. Because if we don't minimize the possibility of having a case, then we might be seeing outbreaks or epidemics in other countries like the one we're seeing in China now. And we don't want to do that. So preparedness is important.
And a lot of people are talking about pandemics. What's the difference between the declaration that we've had of the emergency versus a pandemic?
There are 2 completely different terms. The declaration is a term that calls for coordination, calls for awareness, calls for preparation. It also brings the possibility of mobilizing money. When WHO declares an emergency, governments can internally mobilize money to prepare themselves into protecting their people to minimize or to avoid, not to avoid, but minimize the entrance of a case in a country. Pandemic is a technical term, basically, that is aligned with 2 other terms: endemic, epidemic, and pandemic. Endemic refers to a disease that has been with us for many years. The most typical example is tuberculosis, that has been with us for more than 4,000 years. HIV is endemic also, but a global pandemic also, because it's everywhere. But it's present in our life. Epidemic is diseases that are not present, but suddenly we have a bout or an outbreak. If you remember SARS, Ebola in West Africa, that was an epidemic. And pandemic is when we have these epidemics replicated in other countries, and it could convert itself into endemic also, because let's suppose coronavirus become part of our life for more years to come, then it's become endemic. It becomes part of the. But if you look at Zika, for instance, Zika was an outbreak, was a global emergency also, but it left. It hasn't come back. That was a pandemic and an international concern, but it disappeared after that.
Right. And for the country that PAHO works primarily with, which is the area, that PAHO works primarily with, which is Latin America and the Caribbean, we don't have confirmed cases of coronavirus here yet. But are we at risk of having a case or an outbreak, do you think?
Yes, we are at risk of having a case. We are why is that? Because we're facing a new virus. We're facing a virus that we're learning every day. We know a lot now. We know now, for instance, that it's not killing people the way SARS or MERS were killing people. If you compare the rate of mortality, 10% for SARS, 30% for MERS, and these are two cousins of the novel coronavirus. We now know that the virus produces disease very mild in 80% of the cases, but there's 20% that has severe disease. So there is always a risk when a virus the transmission is by droplets, you know, and we live in a globalized world,
right,
where people in 8 hours you are in New York, in Moscow from New York, or Europe, and so on. So, and as you can see in the past, some cases has been diagnosis detected in ports of entry. So there is a risk. The countries need to be prepared in Latin America and the Caribbean, and they need to base the preparation on the international health regulation core capacities. This is vital. And the important thing is this preparation will benefit them for other potential outbreaks for other diseases,
right,
other bacteria and viruses.
And are countries prepared in the region?
Well, it varies, you know, some are better prepared than others. The key issue is that all the countries of the region, they are much more prepared than, for instance, when SARS. We know more. They report every year to PAHO and to WHO on the implementation of the international health regulations core capacities. What are these core capacities? Basically, capacities about capacity to isolate a case, capacity to detect a case, laboratory capacity. These type of things are in a daily basis in our life, you know, how they are able to detect cases in points of entry. And we are much better in the region on that. But certainly, remember, our region has countries, high income in the north and in the south, middle incomes in the middle, but also low income. So we cannot deny that there are countries better prepared than others. But the important thing in this region is the solidarity, Pan-Americanism, that when there is a disease, regardless of politics, we help our neighbors, our countries, and PAHO is ready to accompany them because we have offices in most of the countries of the region, basically all of the countries except few, but those few without offices, there is an office that can take care of them also. So it's not only Washington, D.C., where we are sitting now. We have offices in Brazil, Dominican Republic, Bolivia, Colombia, Chile, Argentina, and so on.
So we're working with countries
Jamaica.
all over the place.
We're working in the region, and we are at the service of all these countries because the organization is owned by the countries. Right. The governments of the Americas pay their quotas, they own this organization. Right. It's a two entities organization. It's the Secretariat, us, but also the Ministries of Health. And we are at the service of the Ministries of Health. And we're working on a daily basis with them.
So if you've just joined, I'm here with Dr. Espinal from the Pan American Health Organization talking about coronavirus. And if you have any questions, please don't hesitate to tweet us or put them in the comments section if you're joining us from Facebook. Dr. Espinal, so we've spoken a lot about what countries can do to be prepared, but for people like me, just regular people who are worried about, you know, an outbreak or a case of coronavirus coming to the country where I live, what measures can I take to protect myself and to protect my family? So a lot of people are talking, you know, in the media about using the face masks, for example. Do we recommend that? What measures are we recommending?
Yeah, there are recommendations for the public, and they are posted in our website. Most important one, hand washing. With soap and water, all the time. Because we say hello to people on a daily basis, we greet people on a daily basis, we receive packages, we say, wash your hands. It's important because the hands can carry bugs. Also, if a person is coughing or have a common cold or something like that, it's important to use the elbow flex, like this, you know.
Like this, okay.
Because if you do the hands, it's not good.
Yeah, you don't want to shake someone's
Then
hand.
you go and shake hands, and it's not good. So information is also important, and every country should inform the public about this. But I would just want to say, PAHO is the oldest public health agency in the entire world, 1902. Don't listen to fake news. Come to our website. We have all the information there, because there's so much circulating, that is really something that people should not give credit. Websites of WHO, of PAHO, very, very informative. And we have information there for the public,
right,
and also for the governments on laboratory testing, enhancing surveillance, case management or management of people suspicious and confirmed cases of coronavirus.
So I guess our key message is to not panic, but to be prepared.
Indeed.
Okay.
Not panic, be prepared. Somebody was telling me why government needs to spend money in something that the probability of getting a case from China, even if my country doesn't have direct flight with China, is a very low probability. I said, well, but that is a very not good way to see the case, because preparation is key here. And this is not preparation for this outbreak. This is preparation long term.
Right.
It's the core capacities of the international health regulations. And isn't it be better to be prepared instead of reacting when the case is present in a country and no preparation at all? I think that's and in fact, what the governments are doing is investing in health,
right,
for other outbreaks and other things. So preparation is key, and it will serve the countries for other potential outbreaks, because we now live in a world that emerging infectious diseases are a daily basis. Few years ago, we're still talking about Ebola in the Democratic Republic of Congo.
right.
So preparation is very critical, and is a very good investment.
Brilliant. So we have a couple of questions that have arrived. So one is about vaccinations. What's going on as far as developing a vaccine is concerned for coronavirus?
The international community is working at fast pace on the discovery, on the development of not only vaccines but also medicines. However, these processes takes time. This is not from night to daylight. Vaccine, potentially there are 4 or 5 countries working now in a vaccine, but this will take time. A vaccine to be ready to be tested for minimum 6 months to be tested.
Okay.
So it's not something, because we cannot use something that we don't know if it works.
No.
We don't want to put inside people, substances or agents that we don't know if they're going to do harm, or we need to make sure we test them. And similar with the medicines. But let me make the point that most of the cases are mild, and if a person has a severe bout of the disease, we can isolate them and give the care that is needed: respiratory help, hydration, vital signs, and many of the cases recover also.
And then just one final question, Dr. Espinal. Someone on our Twitter, I think, wants to know about the role of PAHO's influenza surveillance and response system.
Extremely excellent role. In fact, we have in the region 29 laboratories through our region that are testing for influenza. And what we're recommending is, you see when I was talking about the core capacities, this is part of the IHR. Those laboratories will be the one doing the testing for coronavirus. And at the moment, there are 9 countries in the region, if my memory doesn't fail me, just testing for coronavirus now. But I can tell you, by February 21st, we will have all the countries, the 29 laboratories, testing for coronavirus,
right,
using the same infrastructure, because it's not to build a new laboratory for coronavirus. Yeah. So the role of Influenza Network has been outstanding on this matter, and we are using it.
Brilliant.
And those countries who don't have yet the capacity to do it, we have reference laboratories in the United States, the Centers for Disease Control, and also in Winnipeg in Canada. These are our reference laboratories for international confirmation. And certainly what the ministries need to do is to get in contact with us, through the IHR channels, the Ministry of Health, through our country representative in those countries, and then we take care of the rest. Make sure that any test that they wanted to run to discard a case or to rule out any case of coronavirus is done. And PAHO has plenty of experience on those with previous outbreaks. Our program on emergencies is not a new program.